Good day, I am Rizakiel Mhadyzon Cantillo, and for today I'm going to perform the administering a subcutaneous injection. So, subcutaneous injection is highly effective when administering medications such as insulin or morphine. So, for this procedure, or prior I will do the procedure, I need first to verify the doctor's order. The rationale is to be assured or reassure that we're giving the right medication to the patient. And the next is I need to perform hand hygiene or observe other infection control procedure. The rationale is to prevent the spreading of microorganisms. And the next is I need to identify the client and observe, or explain plan and procedure to him or her. The rationale is in order for us to know if we're handling the right patient, and also in order for the patient to have an awareness what we will be going to do and how he or she can cooperate. Next is I need to provide privacy for the patient all throughout the procedure. It is important to provide privacy in order for the patient to be comfortable, thus maintaining or having a successful procedure. So next is I need to prepare the equipments that we will be needing for this procedure. These are gauze if needed, cotton balls with alcohol in order to perform the antiseptic technique, clean gloves, and then of course the injection or the syringe which measures 3 cc with the medication inside that measures 2 ml. After that, we need now to prepare the patient. In doing that, I need to assess client to a position which arm, abdomen, or leg can be relaxed. So for this procedure, I'm using the patient's arm. Here is the improvised. So I've used a foam attached to a bottle. Let's assume that this is a patient's arm. And then if the patient is uncooperative, we have to obtain the assistance in order to the procedure to be successful. And then after that, we need now to select and clean the site. So as what I have mentioned, I selected the arm site, and in selecting the site, I need to make sure that it is free from tenderness, hardness, swelling, scarring, itching, burning, or localized inflammation. And also, we have to select the site that had not been used frequently. So next is I have to apply a clean gloves. So it is important to have a clean gloves to prevent the cross-contamination and spreading the microorganisms from patient to nurse and vice versa, from nurse to the patient. Right. So I've switched the position of the arm, the improvised arm, because I am a right-handed. And then after that, we need now to clean the site. So in cleaning the site, we have to have a cotton balls and clean the site with a circular and firm motion from inside going to outside. And then after that, allow the antiseptic to dry. So after that is we need to place and hold the swab between the third and fourth finger. So 1, 2, 3 here, between the third and fourth finger on the non-dominant hand with the or above the intended site. And then now is we need to remove the cap of the syringe while waiting for the antiseptic to dry. So we have to pull the cap, preventing the cross-contamination, and then dispose the needle cap. So now we will now injecting, or I will now injecting the medication. So first, I have to grasp the syringe with my dominant hand, which is the right hand, between my thumb and fingers. Okay, so just like that. The next is I need to place my non-dominant hand on the arm of the patient and pinch the site where we will be injecting, or I will be injecting the medication. So I need to pull, or I need to pinch rather. And then next is I need to insert the needle approximately 45 degrees. 45 degrees. Make sure that always the bevel is up. After that, I need to remove my non-dominant hand and place it to the plunger and inject the medication. And the next is I need now to remove the needle carefully. Alright. So next is we need to apply a gauze if there is a bleeding occur. So we need to apply pressure here, and we have to have a tape in order to secure the site if there is a bleeding. And then after that, I have to remove all of the materials that I've used, or discard all of the materials that I've already used. Dispose it in one area, or the needle or the syringe will be go on the sharps container and activate the needle safety device. And then after that, I need to remove and discard my gloves, and then perform hand hygiene after the procedure, and then assess the effectiveness of the medication at the time it is expected to be effective. And then after that, I need to document all of the procedures that I've done. Thank you.